Okay, we're back for the last half hour of the show. And one of the things that came to mind with Ray's previous question about the residency programs is that it wasn't so much the fatigue part of it. Sometimes it was basically being put on the spot to answer questions about the patients that you had admitted. And it really taught you how to think and how to analyze patients and how to be a better history taker and how to get to the bottom of what it was that you needed to discover. I listened to a talk a long time ago where they were talking about different aspects of medicines, and basically the rule of medicine number one was to listen to your patient long enough and they'll tell you what's wrong. And the corollary to that rule, or the second rule, is if you listen to them even longer, they might tell you how to make them better. So taking a good history and listening to patients is a very, very important aspect of being a good practitioner and listening to them. And nowadays, as you know, some people go into doctors' offices and the doctor is busy typing in the computer because Medicare wants us to enter all this data in electronic medical records. One of the benefits of being an independent doctor is that I can hire someone to sit in the room and scribe for me, and when I didn't have that, I usually dictated the chart in front of the patient. Not a lot of people like to do that, but I did, and would do it again if I needed to eliminate someone in that position. But not being able to have to type that in the computer allows me to look at the patient and talk to the patient and ask the questions that are appropriate to get to the history, because every disease has a story, and every thing has a storyline. It has a time course. It starts and it stops. It waxes and wanes. What does it do? What makes it better? What makes it worse? And these are all very important pieces to try and fit into a puzzle. And that's how you basically come to a preliminary diagnosis, and then you use some of your lab data to confirm or move on to a different direction. And there probably is, I think some of the PA programs and nurse practitioner programs, they leave a lot of that out, meaning a lot to be desired. It takes a person a long time to be able to develop that skill of being able to extract the question, but it also is experience, because you learn in seeing different diseases and you learn different presentations of diseases, and then you put that into practice every day, and that's why they call it practice, because obviously we don't get it perfect. But we basically make a preliminary diagnosis, and then we move on to confirm that diagnosis, and then we move on with the treatment. We had this interesting thing in our office as part of the HMO that we deal with, and it's called the Embedded Nurse Practitioner Program, where nurse practitioners come in and do a history on and a physical exam on our patients as a part of them being a member of that particular HMO. Now, a lot of patients don't want to get that done. They don't see the need for it. They just want to see me or the nurse practitioner that is their primary care provider. But as I tried to explain to patients, that part of that issue is that we as treating physicians are mainly involved in therapeutics, meaning you have a specific complaint. I try and diagnose that complaint, and then I offer you a treatment for that complaint, and then that's either better, or I have to rethink what we didn't do, or maybe what is different, and then offer another therapeutic option. So we're constantly thinking about plan A, plan B, and plan C, what to do down the road. But this embedded nurse practitioner program really just does histories and physicals. And I asked one of them if they were interested in a job. They said, no, I like doing this because it doesn't involve any therapeutics, meaning it doesn't involve decision making. It doesn't involve risk taking. And that could be part of what the depression is that Ray alluded to also, which is that now you have to actually have this burden of proof or this burden of making a life and death decision. Now, it's obviously not life and death, but certainly the idea is not to do your patient any harm. So if you embark on a treatment that is worse than the disease or causes an outcome that's worse than the disease, certainly that is very distasteful for both you and the patient. So there is a low pressure side of medicine, which is basically doing very remedial work and not having to take those decision making and issues. And so, and as medicine is becoming more segmental, meaning that these nurse practitioners or PAs will be, I'll just do neurology. That's all I want to do, and or I will, you know, just do orthopedics or do something like that. They become very specialized in that area, and so they really can't dwell or venture out into do basic general medicine. And it takes a lot to know a little bit about everything rather than know a lot about a few things. And I like it that way because it's certainly a challenge to have those different things being placed in front of you. So, Ray, you've called back. Ray?
One more time.
Ray.
Yeah, it's me again.
Good.
Thanks for answering my question so thoroughly. You did a real good job.
Thank you.
And I might as well bring up something else that happened. Yesterday I watched 60 Minutes. They had the drug czar on, the new guy, who said on 60 Minutes that the drug war is a complete failure. He said, we're putting people in the slammer. We're locking them up for an addiction. He said, we got to treat the addiction part and not just take these people and lock them up in cages. And he was adamant about it. He talked about all different ways that we can avoid this, and that we spent all these billions of dollars for 40 years and we're not succeeding. And he said about the abuse of citizens and everything else because of this drug war. I thought I'd point that out because it's so important for people to realize that the addiction part is not like a criminal. A lot of these things that happen is because they're so hooked on something. And he also said that a lot of the crimes committed that supposedly by these addicts aren't really happening, that it's like over-talked, overworked, or whatever. So I just wanted to point that out to you. If, you know, as far as the addiction part, I sympathize with anybody, whether it be an addiction to alcohol or drugs or whatever, but they have to have rehab, they have to have treatment, at least go to AA or NA meetings. Very helpful. I just want to point that out, and you got a good show tonight, Doc.
Oh, thank you, Ray. Thank you.
Bye-bye.
Yeah, you know, I think the mentality definitely has to switch within the criminal justice system, and I think it has. I mean, in cases I've heard about when someone actually goes in front of the drug court, they have the option to turn in urines and try and get straight. And when they don't do that, they have no choice. I mean, what do you do with a person who just doesn't get it? And battling an addiction is I mean, my God, it's tough. I mean, food addictions, I mean, you have to eat several times a day. So how do you battle something you have to do? If it's alcohol, you know, if you don't go to the bar and you don't go to the liquor store and there's no alcohol around it, you may have half a chance to beat it. Smoking addictions, if you stay away from the vending machines and the cigarettes, you may have half a chance to beat it. Drugs, certainly there are treatment centers, and AA and NA, you know, are very valuable 12-step programs. And if you don't know anything about 12-step programs, the nature of an addiction is doing something despite the negative consequence of the action. So dependency is I need a particular chemical because if I don't take it, my life becomes unmanageable. But in addiction, your life is unmanageable because of the medication that you're taking. So it's the exact opposite. And people need to understand that just because you're taking a medication doesn't make you an addict. It just means you might be dependent on it. Now, where do you draw the line? You draw the line when you do something dishonest to obtain that medication. Meaning you take it not as directed. You take it, you give it to your neighbor. I can't tell you how many patients say, well, you know, someone gave me their Norco. I was sitting out in the office one day. I mean, I wasn't sitting in the office, but I had a patient, and she said, you know, I was sitting in the waiting room, and this person gave me this bottle of morphine, and I'm thinking, are you serious? They actually gave you, a controlled drug? I was willing to run the tape, but I mean, I really wasn't going to get anything out of it. But I had that patient surrender that medication because that's insane. So that's the definition of an addiction, and Alcoholics Anonymous, the 12-step program. The 12 steps take you out of yourself. They take you out of the bondage of this, what they call alcoholism or selfishness. I mean, addictions are incredibly selfish diseases because you lose all sense of who you are and where you are and what your purpose in life was. I mean, one of the things that I heard was that nobody really, when you ask these young kids, they're 10 years old and 12 years old, and they say, "What do you want to be when you grow up?" And they say, "I want to be a doctor, and I want to be an astronaut, or I want to be this person, I want to be that person." I have never seen one 12-year-old or 11-year-old say, "I want to be a drug addict when I grow up." No, it's not part of the reality. Unfortunately, when you expose a certain segment of the population to a chemical for the first time, there's a risk that that chemical does something to them that makes them better than they were, and relieves some internal pain and some internal anguish, and they feel better. But that's the insanity of the addiction, meaning you keep doing the same thing expecting different results, and it just doesn't happen. I mean, that was Einstein's definition of insanity, doing the same thing expecting different results. So no, you're not going to get the initial high that you once get, and you're chasing it, always trying to live in that thing, and you don't know how to get off of it. You can't imagine your life without these particular chemicals. And so anyway, we're going to go to break, but that's an excellent topic, and I will bring it back up right after we come back from these important messages. Thank you.